Welcome everyone to NCUI's Charting Your Course, Navigating Funding Streams to Support Your Health Programs, Series Session 3, titled Cedar Branch, Strategic Planning for Community Advisory Boards. We are honored to have you all here today, and we kindly ask that you place your name, organization, tribal affiliation, and title into the chat box as we get started. In our last community learning session, we talked about how to apply Indigenous data collection and evaluations to increase behavioral health grant funding. And in our first session, we discussed how to use an Indigenous approach for writing grants to private funders. Today, we will cover the Cedar Branch model and how to strategically plan for community advisory boards. If you want resources and video links from session 1 and 2, please let us know by providing your name and email address in the chat box. My name is Sabu Kuyumjian. I am the Public Health Associate with the Technical Assistance and Research Center at NCUI. Joining me from NCUI, our team is Divya Nanduri, Fellow Public Health Associate, Mark Clark, Senior Program Manager, and Noel Zalki from our communications team. We are honored to have you all here today. Again, we kindly ask that you place your name, organization, tribal affiliation into the chat box. In addition, next slide, please. In addition, I want to remind everyone to please take some time today to take our post-community learning satisfaction survey that you see in the chat box, or by using your smartphone and scanning the QR code. This will be provided again at the end of today's session. Next slide, please. Okay. Here is a look at today's agenda. We will promptly end at 3 p.m. Eastern Standard Time. In today's session, I will provide a brief background on NCUI, go over some of the housekeeping items, provide guidance on how to ask questions and engage using emojis, the emoji option in the Zoom chat, and I will also share some upcoming events that NCUI has, and of course, introduce our co-presenters, Kevin Lachapelle and Margie Anderson, to start today's session. At the end of today's session, we will reshare today's community learning satisfaction survey and our upcoming events. Next slide, please. For those who are unfamiliar with NCUI, here's a little background. The National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. NCUI is the only national representative of 41 Title V urban Indian organizations under the Indian Health Service in the Indian Health Improvement Act. NCUI strives to improve the health of over 70% of American Indian and Alaska Native populations that live in urban areas supported by quality, accessible health centers. Next slide, please. As we dive into our session, here's a few things to keep in mind. The webinar is being recorded. Your mics are muted, but feel free to unmute if you'd like to share anything. And if you can, type your questions or in the comment or chat box, and we will address them. Emoji-based feedback will also be used during this session. Instructions on that will be provided shortly. And there is a activity after today's presentation with a Q&A offered at the end. Next slide, please. So to ask a question using the chat feature, go to the bottom of your Zoom screen, then click on chat, type the question or comment into the chat box, and it will appear on the right of your screen. Next slide, please. Here's a few instructions for interactive participation during the session. To use emojis to respond, first open the chat box, make sure your chat box setting reads everyone, and then open the smiley face to select your emoji. If you have any trouble accessing any of these features, please message our Nikui staff present in the chat and we will assist you promptly. We also want to share some upcoming events that we would love for you all to join. Tomorrow, our next session, virtual session, is on November 17th, titled Messengers in Health, Community of Learning Session, Series Session 2. The session is titled, "'Tis the Season to Vaccinate, Flu, Pneumonia, and COVID-19. We also welcome UIOs for Nikui's 2022 Focus Group Series that will be conducted on November 18th, 19th, and the 22nd. We invite Urban Indian Programs to join Nikui staff for a discussion on priorities for 2022, a review of accomplishments and challenges in 2021, and an opportunity to provide candid feedback about other experiences. Each focus group is broken into different UIO types. So pick the UIO type session based on your UIO type. There is a makeup session on November 22nd. If November 18th and 19th dates and times do not work with your schedules, registration for the info of each of these sessions is provided in the chat box for you all to register. Next slide, please. Now, let us welcome our presenters, Margie Anderson and Kevin Lachapelle. Margie, Yoeme Apache, born for Native Hawaiians, supports education and applications that lead to positive restorative ceremonies and traditional culture for Native American and Indigenous persons. Margie is a certified alcohol and drug counselor accredited by the California State Board and by the Department of Healthcare Services. Margie is an experienced provider and substance abuse counselor for San Diego American Indian Health Center. Margie provides assessments of alcohol and drug use disorder, diagnoses, and treatment planning for individuals, couples, families, and groups of diverse ethnicities. Margie has a true passion for helping adult and youth populations, knowledgeably blending traditional, cultural, and medicinal teachings into her practice. Margie is known to her community as a Wellbriety facilitator, a Generation Red Road facilitator, Talking Circle co-facilitator for Spiritual Solutions Talking Circle, and certified traditional tobacco educator. Our next presenter is Kevin Lachapelle. Kevin previously served as National Director of Care Experience, Patient Safety and Risk for Kaiser Permanente. Kevin was also a consulting advisor for Press Ganey and Associates, corporate director of Sharp Experience, the Sharp University, and consumer research at Sharp Healthcare. Mr. Lachapelle also was the director of support operations at Script Health, adjunct professor at National University and Walden University. Kevin also served as a police officer and elected school board member. Kevin is a Six Sigma Black Belt, received his bachelor's in business management, minor in organizational behavioral development, master's in public administration, and doctorate in education leadership. Please welcome Margie and Kevin with heart reactions and emojis in the chat box. And I want to now pass Margie the mic to start her presentation. Margie, the mic is all yours.
Okay, greetings. Thank you, Sabu, for all the pre-information and getting us started. And I'll introduce myself in a good way, and I say Yat e Dagote Niosim Shin and Yavu and Aloha in that traditional way, and greeting you. You know, it's the day starts, and you know, just sharing that good way, like the culture. So thank you for all being here. Thank you to all my relations for being here and sharing in this moment. I want to offer a prayer in a good way. This is a good way to greet ourselves here. I'm going to take a moment to light up some white sage here. So I'm in San Diego right now, or we call it the land of the First Peoples Nations, the Lasenia, the Kumeyaay, the Ipai. And this white sage comes from that mountain up here. And it was given to me by my family, my relatives, my relations. And as I light this sage in a good way, I'll offer an opening prayer for us all, and this is a time for yourselves too, to center yourselves, bring your awareness in. Nijonako ahot and beauty, it begins. And I thank you, Creator, for blessing us with the sunlight this morning. And I thank you, Creator, too, for blessing us with that sunset we'll experience this evening. And thank you, Creator, for my ancestors, our teachings. Thank you for the blessing of everything that we'll have from that sunrise to the sunset, and the things that we'll partake in, and nourish our bodies with emotionally, mentally, physically, and spiritually. Thank you for blessing us with our meals today and everything as a whole. Prayers for our youth, our communities, and especially the ones yet to be born. And when we close out in prayer, I say, Hojona Asklin, and beauty is finished. Hojona Asklin, Hojona Asklin, Hojona Asklin, and beauty is finished. And then that way, it's kind of like that saying that amen, if that's your belief systems, or aho, they say. So with that, Creator, thank you for allowing me to express this prayer for us all. So we're ready to go forward, right, Sabu? This is a presentation that I put together in hopes to share with you the beauty of beginning your coalition and learning about hopefully learning about what's available out there for us in the way of training through CADCA. Next slide, please. In here is the overall objectives. We want to understand the Cedar branch model. Cedar branch is what it is. It's the community engagement, diversity, action, revitalization. And number 2 is to learn to develop an effective, diverse, and culturally competent community advisory circle. Number 3 would be to turn that qualitative community feedback into comprehensive strategic planning and data too. So building an engaging coalition focused on community culture and healing. And then the last part, I'm sure we'll have time for that, is an activity, stand and share your strengths. And I want to thank my ancestors for teaching me that. Next slide, please. Exercise skill check, and go ahead and read along with me. And we're going to be using the chat box, I believe, as Sabu expressed. Please use the emojis in the chat box to answer the question, utilizing what is your knowledge or on strategic planning skill keys. So I'm a Jedi master. I don't think I'm going to put that one on there. I'm competent. I feel competent, or I'm a beginner, or I'm a newbie. So let's get to work. So you can join us and put those emojis in there in the chat box. Let us know how you feel about where you are. All right, here's some coming through. Yay. All right. Who can see all of that? Is that you, Sabu?
Yeah, are you talking about in the chat box what people are putting?
Yeah.
It's a mixture between some beginners and newbies, with some folks also competent in
Okay, good.
strategic planning.
All right. Well, this is all good information. It's good to know. And hopefully what I will present will be something that will interest you to and to help you get started. Oh, do we want to move on to the next slide? Okay. On this slide, it says Cedar branch model. And again, it's Cedar, what does it stand for? It's community engagement, diversity, action, revitalization. I put a branch of Cedar in there to remind me about how we came to this. So we were, all of a sudden, my name's on the grant as, coordinator, manager, and started reading the grant, and there's a lot to do. When we get those grants, we're like, wow, we got the funding. What are we going to do with it? How do we approach this? How do you cut this or break open this? So we laid down some prayers, and part of that we were lighting cedar at the time. I was home with my husband. We were lighting some cedar and praying on it, because when we received this funding, it was maybe a prayer answered, and we wanted to approach it in a good way. I certainly did, and so we laid, burnt the cedar, laid down the the medicine and prayer, and boom, this is what we're going to start with, a cedar group. So when we received the grant, part of this is we needed to build our first team meeting, get ourselves ready, the coalition. So from the Cedar, this is the grant support meeting. That what I mean by that is that was our initial meeting with people that were engaged in the grant purpose here at our level, the admin level. And then through that, we created the Cedar branch meeting. So Cedar was needed as a steering committee, so we can utilize that grant purpose appropriately. So we have this 5-year grant, and through that we created the Cedar branch, which is a community coalition. We meet once a month here with the community. Community is also our providers and patients, and anyone that is in the community can be part of it. And how did we get to that? That thinking. Part of it was taking part in training for myself, which is the CADCA Native American Boot Camp training. And it's the Community Anti-Drug Coalition of America that puts on this, the training. And, without that training, I want to lift Melanie Johnson and Raquel, taking that training and seeing our Native women put forth the education. And again, that's what's needed for us. It was when I took that training, I totally jumped in with everything I had to learn as much as I could from them, because that's an honoring way that I was taught, that when our women step up and provide the teachings, that's a blessing for us. So I want to lift them up and thank them for all they do. Anyway, this training really is an important tool for me. It provided the focus to increase capacity for our Native American urban programming here with regards to our grants. It's offered ways to improve our substance use prevention practices here within what we do here for our clinic and our community, enhance the abilities to competently respond to grant objectives and directives. That's a big thing. So reporting back to our grants, this is a very valuable tool. So we'll go on to the next slide. Part of this is developing an effective, diverse, and culturally competent community advisory board. Learning about our environment first is the first thing that I learned through this CADCA is like, when we're taking a community needs assessment and that type of thing, it was, we need to learn like where we are with our community. So learning about our environment and how we serve our community was an important part of this. So using San Diego American Indian Health kind of like as the, the starting point, and then seeing where we are and who we serve. So we're the urban sector. I always say we are on tribal land, but we're not on what they designate as reservation land. So we're in the city of San Diego, and we serve the urban sector primarily. It doesn't mean that we don't serve tribal, we do. And that's the beauty of this clinic. So we have a behavioral health, substance abuse treatment, medical, dental, and a youth center. Our location is, like it says on here, close to downtown San Diego. I mean, I could probably walk from my clinic downtown to the, to the harbor there. And that's how close we are. Part of this is, creating the Cedar branch, especially during this trying time. And I know everyone has, and the world has had to deal with COVID, and developing those safety for our communities. And part of what we get to do in the Cedar branch is we have a safe area for us to meet. We also offer a Zoom link to it as well. So people that are, not ready to come in person for whatever reason, we want people to feel safe, and coming in through Zoom is another option. Welcoming the community and providers together is something that's really working here. And I think it's the energy that when we come in there, we want to focus on what's positive and experience a good time. Part of this is we have a prayer meal. We embrace the language. So we want you to bring your culture in. No matter who you are, when you come into that door, we want you to share your language. We feel that that's part of a healing process for a lot of us. Traditions and culture, we do storytelling, we do honorings, we involve the culture and music and other medicinal teachings. Next slide, please. I wanted to share with you too, just what our little agenda looks like to help you out. So this is, again, developing that advisory circle, or part of it too is our coalition building. So what we wanted to do was build on our coalition. Our first coalition was centered on the people we serve here at the clinic. So we're focused on Native American approach, but we serve the whole community as a whole. And that's the beautiful thing here. So we have many, it's a diverse community that comes into the Cedar branch. So I took a snip of what our last agenda looked like, and this is pretty normal. We'll have an opening prayer. We have a spiritual advisor here, Rob Anderson, who opens up our meetings. He also facilitates the wellness circles as well. We'll open it with a meal. We have a review on our grant objectives, which we have Martin, who takes care of our grant processes here, and Brooks, who is our data person here. So I felt it's really important to have them in there as well, so they can see and feel what's going on in that Cedar branch. We do some introductions, especially as we have new people coming in, and that'll help us to welcome them in. And we use what's called stand and share your strength, cultural activities. Of course, the last one was in regards to the sacredness of the rocks, which included storytelling. And we offered the opiate training, our education, and the fentanyl education, as well as Narcan. And then we have an open discussion with our family there, or our relatives, and we close out in prayer. So the next slide. This is part of it. As we started to move forward with, what the grants was objectives or what they were asking us to do, in developing our community. Part of this is getting feedback from the community. How did we do that? We needed to learn a little bit about together. So it wasn't, it was a teaching moment for myself and for our community, which was really important. It felt wonderful to work with the community and learning about strategic prevention framework. How did I do that? How do we do that, with community members? Part of it too is learning how to assess our communities, learning what capacity we are in, learning about planning, implementation, evaluation, sustainability, cultural competency is part of that as well. And so what we did was we took the community and gave them the space and time. We also fed them. And they showed us by creating these, I call it artwork, about what our community looked like. So they did that for us. Those are the two pictures in there. Everyone had fun and they felt good about what they were doing, and learning about their community. Part of this is breaking down what the assessment is looking like. Like, we can describe what our community looks like. We can even talk about the history of the community. We talked about the community needs, resources, also the risks in the community. We found that there's about 5 cannabis stores in our zip code. And we wanted to be aware of that too, because maybe this will guide us in a future what we can do with our community coalition. So next slide, please. So part of this too is learning, bringing those CADCA trainings and the tools into learning how to do our needs assessment. Where do we learn about our communities? Part of this is learning about logic models. One of the things that I shy away from, I would say, I don't throw myself in there, is like all those little, I guess the graphics of it maybe. And so I thought about this, how can we bring something, SAMHSA has their language. How do we bring this language to our community so that the community feels like they understand it, that they can be part of it? And I know in our culture, we're connected to all things. And when I saw this tree model, that blew me away. I said, we can use a tree model with this. And I said, I feel totally at home with this. I can do this. We can do this. So this is how we did it. We used this tree model to check our community out, find out what the needs assessments are. On the bottom of it talks about the root causes and what's going on with our community. Part of it too is looking at the local conditions, root causes. Maybe is there some specific drug use or misuse that's prevalent in our area? For us out here, it's definitely fentanyl, which is really scary, So also we want to know what the consequences are of using this substance. So we use that tree model, and it worked out. It turned into data, which Brooks was very good at turning that around and making it a true data that we can report back to the grant, and report back to SPARS. Some of you may have a relationship with your SPARS. Anyway, we'll go on to the next slide. So when we talked about putting this, forth to the community, that tree model, I explained to them a little bit what I needed. Somebody grabbed the pen and went full force with this. And then once that person started drawing this tree, everyone in the room got connected with that. And they started coming up with ideas and what this tree would look like. So this is an actual picture of what we came up with in our Cedar branch meeting. And it took minutes. And I was so, I was impressed and overwhelmed emotionally to see our community come together that way to put something together like this. And what my first thought was, they did my homework for me. They completed and got it done. And we take pictures because that's an important part of reporting to the grant, so they can actually see what we're doing with the community as well. I also do like a little summary at the once we have our Cedar branch meeting and it's done. We have a sign-in sheet for them, so that little summary, the pictures, sign-in sheets, everything goes together in a nice little neat package, and it gets reported back to the grant. So I wanted to mention that as well. The next slide, please. This is the part that we felt was important to share with all of you is building and engaging the coalition, both focus on the community culture and healing. So we wanted to have a safe place for our community and to really engage our Native American community here. And it's our Native American, Alaskan, and Indigenous communities. So having the diversity and welcoming it into the circle, we have what's called like the talking circle format as well. So no one's left out. Everyone has an opportunity to share. We encourage the Native language, use of the drums, songs, use of traditional medicines, eagle feathers, ceremonies, honorings. We want to make sure that we continue to lift our community up by providing honorings, like for our elders and our youth and others as well. We use artwork as well, crafts, picture of some river rocks that were part of the storytelling on the 27th of October to help us work through having that education, because the education sometimes can be triggering and hard. So we were doing the opiate training, and we decided to, as the person's putting on forth the meeting, was to do the cultural activity, bring that forth, so people had something to work on and focus on while they were hearing the education, because we wanted people to have some kind of grounding and holistic support with that. And it worked out fine, because after we, got to the point, we have the discussion and people said, thank you for giving us the rocks. They were all proud of their rock art and they displayed it really nicely. So I wanted to bring that up too as well. Next slide. So this is inquiry. We'll be using our chat box, and please feel free to put in there and answer the question is, what traditional or cultural teachings do you use in your in-person or virtual gathering meetings? And you can identify other things too as well. It doesn't have to be off the list that was shared. Gabriel says, open with prayer and land acknowledgement. Nice. So Marina, thank you for sharing that. She says our programming has primarily been virtual because of COVID. Yes, true. But we make sure to continue opening and closing activities with prayer. Yes, that's very valuable. Okay. And these are things too you can think about. And part of this is asking your community to be part of it, because part of bringing the community is bringing them in and welcoming them and welcoming their traditional ways as well. Mhm. Next slide. And I put this in here for our relatives that may not know some of the things that, you know, like in a general sense about working with natives or partnering with them, as helping our allies understand and working with their native cultures. And so this slide was provided to me from a relative from New Mexico. So this may have popped up somewhere else and you're like, hey, I know where that slide came from or something like that. And I got permission to share this because I felt that this was an important part of it too, as we come together and work together, having good alliances or having our relatives as allies to help bring healing to our communities is as part of it. So becoming familiar with the local communication style for us out here, you know, like being respectful, so modify as appropriate, slowing down, listening, and it's okay to ask questions. I wanted to mention that too. People will appreciate if you ask the question versus assuming. Ask about their tribe, their family history, ask about ideas of healthcare, personal practices and expectations. Rapport building may take longer when establishing rapport because this is about establishing trust, really. And we look back on the history of Native America, and what we relate that to is the broken treaties. Mm-hmm. And learning how to stick with your word, understanding the possibility of system transference as on here is when past experience with systems, federal government influence current feelings and reactions to systems. So, I mean, that's part of, you know, maybe what we were going through here, but having a space for them to come in and express is really important. Mm-hmm. Community history of genocide, where warfare and disease is part of it, broken treaties and reservation policies. Next slide, please. So this comes to our activity, and if I can ask everyone here to participate, even our relatives here at Nikui, and I'll step us through it. So you may have to adjust your camera a little bit so we're not all at belly button there level, but I'm going to start and I'm going to stand up. So this practice was taught to me by my grandmother, and my grandmother's from White Mountain Apache, and we all lived out here in California, so they were part of the Native American Relocation Act. Just make sure you're safe so you don't bump anything or hurt yourself. And when my grandma would teach me as a child, she would say, you know, away, you know, like, stand up, my little one, and stand up, but you're not just going to stand up. She would say, feel your feet on the earth, you know, ground yourself and stand up with purpose, you know. And she would say, your first person's here. She would fill me with affirmation that don't have fear, walk, you know, this Turtle Island, this belongs to us, you know, don't walk with fear. But she's also sharing with me to stand up with purpose, with everything I have inside of me. And here she would say, we have in this, our spirit that is here, but it's in this, the people, but it's more than that. It's the spirit that we have inside, and hold yourself up, stand up. So in our community Cedar branch group, our new persons, and we all get a chance to stand up and we introduce ourselves. We encourage that you know, that language, And whoever it is that knows their language is encouraged to express that way, but we also share that strength that we're feeling right there in that moment. So that strength could be, creator. It could be, that walk you took today, something that brings well-being to ourselves. And in that way, that's an important way to continue our walk throughout the day. So when our people feel this and express, we're not even just sitting there, we're cheering them on, clapping, and people feel that healthy well-being within themselves. And so we want to continue to promote that. You guys can go ahead and sit down. I thought it would be better to do it as a group, that engaging. And do we have time? A couple of minutes? Okay, I want to start with Mark. Mark, what was that feeling that you got as a strength?
The feeling I got as a strength was that sense of feeling rooted, sort of like your tree when you said to stand on your legs and almost feel the core. And, it's we get so used to sitting all day long. So I felt a real charge with just standing up and thinking of those strengths that you mentioned. I know in particular some of the things we've done with our youth council, and I believe Sabu will share more about those, but those are the things that keep us rooted and keep us thinking of those next generations and the sharing that's so vital to what we do. So that's what came to mind for me.
Okay, that's wonderful. Yeah. And so that's a real, something real. No one can create that for you. You're creating that within yourself. And that's what's important to share that. And a verbal expression, we talk about finding our voices, but grandma will want to know, what are you feeling right now? And that tells her a lot too, so we want to promote that wellness from within, and that's one way we can do that. Is there anyone out there that would like to share what their strength is? What did you feel?
And feel free, anyone that y'all wanted to unmute and share your experience. I could say for myself, I think, as Marina just said in the comment, what Mark just said, like feeling rooted, right, when you stand up. I just thought when you had said, like, speak in your language and introduce yourself, I'm mixed, right? Like, I'm indigenous Egyptian and I'm Armenian, and I know 2 different languages. So like, I was thinking in my mind, I was introducing myself, but in my mind, in that language, to remember, my ancestors, where I come from, and my, so I appreciated that of the exercise. And if others want to share, please unmute your mics if you'd like.
I noticed in the chat box that Marina had said that she felt that same sense of having a strong base and feeling rooted from the standing exercise. So thank you for sharing that with us, Marina.
I see another from April. Thank you for the exercise. My strength is connected to family, tradition, and community. Standing up felt empowering, yes, and could feel the strength of my ancestors. Thank you for that, yes.
Well, I guess this is a good time also to ask, what ways do folks here in your communities, in your programs, that you utilize to help strengthen meetings or help get people regrounded? If you'd like to share those, whether virtual or in person.
was asking to repeat the question.
Yeah, I had just shared and said, you know, what do folks in the chat in our session today, what are activities or exercises you do to help with your meetings to help your members feel regrounded and strong? And I think Arvil has a question. So you could unmute your mic and speak. Sorry.
Yoeme Takiape, Ava Cordova Machiape, Malacota and Taos Pueblo. My Thama is Joseph Conquilla Cordova. My Ina and my cause Patricia Cordova. I'm the owner operator of AC and Associates, also a board member with American Indian Community Council. I'm a co-host with a virtual show called the Paku Wellness Hour. I am thankful for sharing space with you and allowing me to be here today. And I open my introduction with all the many hats that I wear: mother, community member, unchi, grandmother. But one of the things that I feel empowered about is that I can collaborate with many different orgs and individuals, which allows for community. And one of the things when that happens is people feel safe to come to me and speak about their different issues or problems or what they like to see in community. I feel like when you have a trusted community person that you can turn to, a lot of things can come about, from ideas to strengths to people that you can collaborate, funding as well. So that's what I wanted to share. Thank you for allowing me to speak, and thank you for allowing me to share space.
That's beautiful, April. And I'm so glad that you used your language. And I encourage us too in here to express your language. It's healing. And like she said, she wears those many hats, and she's trusted in the community. And we're all learning to do that, you know, in a good way, to bring that full circle. You know, we felt like this Cedar Branch has done that. I mean, we started with Cedar Branch back in March, and we didn't know what was going to happen with COVID and you know, everything that was processing. And now today I have a list. So we keep the room safe. You know, we keep it about 15-person capacity. It's very well ventilated. We have air purifiers in there, and we use masks and other safety measures too in there. And now I have a waiting list of people desiring to come join us at the Cedar Branch meeting. So, and that's exciting. We do rotate. So if someone calls me and says, you know, I got this family event I need to go to and I won't make it, we call, get on the phone, and we welcome the rest, whatever community we can in there to take that seat. So. We okay with time to open it up if someone else would like to share?
We actually have time for Q&A too, since we're going into that portion of today's session. So I know that there's some information you want to share with folks in the upcoming slides, and then we could also have Q&A if there's additional questions from participants today on Cedar Branch, on things that might that they want to get further clarification or information on.
Okay, so we'll go ahead and go to the next slide. Thanks, Sabu. So speaking about the CADCA and the virtual Native American boot camp training, it's, first off, I want you to know it's free. It is 4 days of education and support, and it's focused on, like I said, the coalition building. But within that coalition building, there's a lot of these learning about public health models and prevention science, the coalition work, 7 strategies for community change, and the elements of the strategic prevention framework. And this is put on by Melanie Johnson and Raquel Ramos. And like I said, for me, it was important to see and hear and get that feeling of our Native women stepping up and taking those leadership roles. And it was very empowering to me. And just like April said, standing up and feeling that empowerment and knowing that this training is put in a good way for us to learn and to help our communities. So I want to share that. There's her contact email up there. You want to take that. And then the next slide. This is both Kevin Lachapelle, his information there, and my information as well to contact us if you have any questions afterwards. Please feel free to contact us. I just want to put a shout out to Kevin that Kevin's been our new Chief Executive Officer here, and he's promoted so much well-being and good here at the clinic, and definitely is encouraging us to move forward with our Native American programming here. And next slide. Oh, the Q&A, we're there already. Questions and answers. You can also put your questions in the chat box if you want to, if you have any, or you can unmute yourself.
I don't have a question. I just want to say, thank you, Margie. I've never personally met you, but that I remember actually, but I see your stuff on Facebook promoting your substance abuse through social media and the different meetings that you have. And social media is a major thing for me personally. I do a lot of social media, and I also do, like I said, a virtual event for LA County, or actually it's all over the place, and I see your stuff a lot. So thank you for your continued work in your area. I see you.
Thank you, April. Thank you so much for that. I'd like to connect with you. We have some really wonderful upcoming events that are, it's community events, but it would be nice to have you as part of that too.
Yeah, that sounds great. A lot of times when we gather and we get together, someone will come up with just a simple idea, and us collaborating or working together, using different pots of money, using different ideas, and definitely being a voice of community or for community, or even encouraging community to share on their own, our youth to speak up. I've seen, I used to work at one of the largest nonprofits in Los Angeles called United American Indian Involvement. I was a care coordinator with 7 Generations, which is a mental health department of UAII, and just being able to listen without judgment is something that individuals in our community and people appreciate, I guess you would say. And I really appreciate this time together and seeing how funding and communities' voices is certainly important for everywhere.
Wonderful. Thank you for your voice and expressing. And those words will go a long way. That's carrying that message that we so much need. Yeah, much needed. Thank you for all you do, April.
Thank you. You're welcome.
Okay.
So I think we can go on to the next portion. Thank you so much, Errol, and thank you, Margie. Next slide, please. So thank you again for joining. In the chat box, we will have a survey for the post-community learning series for you to provide your feedback on how things went and what you liked and how we could improve future sessions. Also, if you want resources from session 1 and session 2 of this series, please provide your name, email address in the chat box, and we'll make sure to send that to you. Additionally, we wanted to thank our wonderful speakers, Margie Anderson, for show your support today for her and appreciation through celebration reactions in the emoji chat box or through your reactions in the options that you have within Zoom. As a reminder again, we have some upcoming events that will be posted in the chat box that you can click on to access this for future events. So our first one is tomorrow, titled Messengers in Health, Community Learning Series Session 2, focus on the vaccine, flu, pneumonia, and COVID-19. And then we have our 2022 focus group series on November 18th, 19th, and the 22nd for UIOs to join and have a discussion with staff on priorities for 2022, our accomplishments for 2021, and some challenges that came with it, and opportunities to provide candid feedback for your experiences. And those registrations will be provided in the link. And I want to thank you all again for joining our session on Cedar Branch Strategic Planning for Community Advisory Boards. And thanks again for our amazing speakers, Speaker Margie, for all your gracious support and guidance today. And we look forward to seeing you all again in our upcoming sessions. I hope have a great rest of your day, everybody.